Joining me right now to weigh in is House Speaker Paul Ryan of Wisconsin. Mr. Speaker, thanks so much for joining us. So happy to have you on the program.
My pleasure. Good morning. Good morning. How you doing, Maria?
Good to see you. I want to begin with really the top story in the Journal today, and basically the first line is many Republican senators are warning that the bill will not become law without fundamental changes. So the question is, where are you willing to give on, Mr. Speaker?
Well, obviously, we're going through the legislative process. Here, it's a four-committee process. So obviously, as we go through this, we make refinements and improvements to the bill. That is occurring. That's how the legislative process works. And by the way, senators, they're not helpless to what the House does. Once the House is done with this legislation, we pass it and send it to the Senate, then they take it. And then they amend it if they want to amend it, and they do what they want to do with the bill, because that's how the legislative process works. So I would say just to senators, when it comes over to their place, they have this thing called Vote-A-Rama, where they can have all these different amendments. That's where, if they want to make changes or improvements to the bill, they'll have that opportunity, because that's how bills become law. And so we're going through the process here. We feel very good where we are. We're making the kinds of improvements and refinements that we think make this bill better. Now that we have our score from the CBO, that's something we were waiting for. Now that we've got it, we've got room to make refinements. Obviously, the major components are staying intact, because this is something we wrote with President Trump. This is something we wrote with the Senate committees. So just so you know, Maria, this is the plan we ran on all of last year. This is the plan that we've been working House, Senate, White House together on. And now, as we get closer to finish going through the committee process, you inevitably make those refinements and improvements as you go through that process. That's exactly where we are right now.
So what are the major things that would stay and would not move? I guess the people are saying, okay, sure, this is the plan that you've been running on, this is the plan you've been talking about, but the truth is, Mr. Speaker, we've been hearing about we're going to repeal and replace Obamacare for 7 years. A lot of people are saying, you had 7 years to come up with a new plan. Now some people are calling it Obamacare Light. Was it just too difficult to just throw it all away and do a full repeal and come up with a full replacement?
So first of all, we don't have the votes for just a full repeal, because so many of our members, and the president included, said repeal and replace. And if we just did a repeal with reconciliation, meaning 51 votes, and not replace, then we wouldn't be able to get a replace passed, because they can filibuster or replace. So the promise that was made to voters by everybody running for House, Senate, and President was, we will repeal and replace. And so we're using the budget tools that we have in the Senate to do repeal and replace. Remember, Maria, this is why we have a three-part process. If we could put everything we wanted into this one bill and have it vote on with 51 votes in the Senate, we would do that. But because of the Senate rules and how narrow they are to do what we call reconciliation, you can't put everything you want in that bill, like, say, interstate shopping across state lines. And so this bill is what we can pass through reconciliation, which effectively repeals and replaces the law. It's a very good start. It's actually an excellent start. It's the plan that we did write last year, that we did rain on last year. And then phase two, Tom Price, deregulates the marketplace, lets the states go back to open up their own health insurance markets, which is enormous market freedom. That's what we mean when we say a free market, a patient-centered system. And then part three, which we're working on at the same exact time, those other bills we believe in that are necessary and helpful, but you can't put in reconciliation, that could face 60 votes. Interstate shopping. Let people buy their health insurance through a nationwide buying pool through their trade association, like the Farm Bureau or the Restaurants Association. Medical liability reform to cut down on the practice of defensive medicine, which costs so much money. Those are things that we really believe in, but we know we can't bring it through the Senate reconciliation, and because it would otherwise filibuster the whole bill. That's what's going on here. So the problem is, Maria, it took me like 7 sentences to explain all that.
Yeah.
It's that confusion that is all around. The point is, we had a plan, we have a plan, we're moving this plan, and we're making fine-tuning refinements to this plan as it goes through the legislative process, which is how all legislation works. Then it passes the Senate, House, goes to the Senate, and then they take it from there.
Right.
That's how the legislative process works.
And it's that timeline that has sparked so much urgency on the part of the people. You know, you just went through it very clearly. You say it's confusing. It's not. Our audience understands where you are and why you had to do it the way you did it. And I want to ask you about that in a minute. But in terms of, for example, Medicaid, you've got Rand Paul out saying this is a complete giveaway. This is Obama Light, Obamacare Light. Would you consider giving Medicaid to the states? Let the states deal with it.
That is what we do. That's where I'm really kind of confused about this lost in translation. This legislation gives a per capita block grant back to the states. It turns Medicaid over to the states. and the states run it from there. It says we're going to phase down these expansions so there's no more Medicaid expansion. It says we're not going to give these exorbitant reimbursement rates from the federal government, and we're turning this program over to the states. And the state legislatures and the governors take it from there, and then they craft Medicaid how they want to in their states. That is what this bill does.
Did you not think you would be able to pass this without the 51 votes? Is that without the you needed the 51 rather than the 60 votes? That's
Correct.
why you decided to do health care first, because a lot of people feel.
Let me just get you there. We know we can't pass it with 60 votes. You know why? Democrats created Obamacare. Democrats don't want to get rid of Obamacare. Democrats know Obamacare is collapsing, and what they prefer is Medicaid for all. What they prefer is single payer. So we know that the architects of Obamacare aren't going to work with us to get rid of this law and replace it with a decentralized, local control, free market, patient-centered system. That is not what Democrats want. They want single payer health care. This is why we know we have to use the tools that we've got, which gets around the filibuster in the Senate.